All right. I know we'll have people kind of entering as they're able to join, probably some people hopping off some meetings, but I thought we could go ahead and get started because we have a really jam-packed webinar set for you today. So, hi everybody, my name is Jess Henshaw and I'm the Program Manager of Environmental Health Initiatives here at NACC. And we just wanted to thank you so much for joining our webinar today. I'm going to go quickly over the agenda. And please feel free to keep introducing yourselves in the chat, your organizations, and where you're coming from. But first, for our agenda for today, we'll have a welcome and introduction from Ben Money, who's our Senior Vice President of Population Health here at NACC. Then we'll have some federal updates and announcements from Nova Thayer, who's part of our public policy and research team at NACC. Then we'll shift to some opportunities for health centers, and we have Becky Regan from Capital Link and Andrew McCullough joining us to give a really exciting update. Then we'll shift to our partner, Ben Fulgencio-Turner at Eco America, who will talk more with us about climate change and impacts on health. And we'll also close with a case study from Reginald Vicks at Crescent Care. And then we'll leave some time for question and answer at the back end of our presentation. But please feel free, as you have questions that come up, drop them in the chat, and our colleague Sarah Halpin will be making sure to flag those questions that you have so we can bring them up during the Q&A section. Also, Sarah will be dropping helpful links and resources into the chat as we go through our presentation. So with that, I first want to bring Ben Money onto the call so that he can give us a welcome and introduction. And as I said, Ben Money is our Senior Vice President of Population Health here at NACC. Thanks, Ben.
Thank you so much, Jess. And for NACC, environmental health is a new initiative, but it's not a new initiative for health centers. We started our work back in 1965 with the start of the first health center. And at the very beginning, environmental health was one of the key elements that needed to be addressed to assure that patients of the health center could be as healthy as possible. And when we think about environmental health, the World Health Organization really lays out a broad framework: clear air, stable climate, adequate water, sanitation and hygiene, safe use of chemicals, protection from radiation, healthy and safe workplaces, sound agricultural practices, health-supported cities and environments, built environments, and a preserved nature are all prerequisites for good health. Think of that, prerequisites. And next slide, please. When we think about the role of the community health center, how does environmental health play into this? Well, it's part of the Section 330 of the U.S. Public Health Services Act, which authorizes the health center program. It's our program statute. And within subsection B2, health centers are authorized to provide additional services necessary for the adequate support of primary health services, including environmental health services, including the detection and alleviation of unhealthful conditions associated with the water supply, chemical and pest exposure, and air quality. So you will hear us at NACC refer to environmental health as the broad umbrella, and climate change as one of those factors that is critical right now in terms of our ability to assure environmental health, safety, and protection for the patients that we serve. Next slide, please. And why are community health centers important in this role? As I said before, it harkens back to the very beginning of the health center program. In fact, I had a conversation with John Hatch, one of the founders, Dr. John Hatch, one of the founders of the health center program, on Tuesday. And he recalled the work in Mount Bayou, Mississippi, to provide sanitation for residents. And when we think about the role of physicians, physicians have always been instrumental in delivering health messages. And right now, environmental health and climate change are really existential threats to the health and safety of our public. And so primary care physicians are one of the most trusted sources of information. And this really comes from the 6 Americas study. They're the most trusted source for climate change and environmental health information. George Mason University Center for Climate Change does this research every year. And all in all, health center, primary care physicians are really the leading voices. Next slide, please. And so that's why we as health centers need to be re-energized towards the work of environmental health and particularly climate change, as these threats impact the patients we serve first and worst. And so we began our work, as I said, back in the spring of this year, actually. Jess Henshaw has come on board and done a tremendous bit of work in getting our foundation established. And so we're really focusing on some key issues of awareness and activation to make sure that we've got good information heading to health centers for your decision making. We're focusing on some critical areas, patient-centered resilience from extreme heat, looking at statute again on air and water quality, the efficiency of health centers and their operations, food security and waste reduction, and importantly, telehealth. Telehealth is one of the ways that we can actually lower the carbon emissions of a health center visit. And so our objectives are really increasing the engagement of health centers in activities aimed at reducing patients' exposure to environmental harms, reducing the emissions, the greenhouse gas emissions from health centers, and also strengthening resources to address social drivers of health and environmental related needs. And so some of our key activities involve a partnership you're going to hear about later today with Eco America in their Climate Change for Health initiative. We have within NAC established the Environmental Health and Climate Change Interest Group, building off of the foundational work of the California PCA and other PCAs on the Western coast. We also are working with Harvard University's Chan School of Public Health and their Climate Change Initiative, Migrant Clinicians Network, AmeriCares, and the Extreme Heat Resilience Alliance on an Extreme Heat Resilience Learning Collaborative that will be introduced next month. We also are partnering with Capital Link and Collective Energy on a charge partnership, and we've got Becky Regan and Andrew McCullough from Capital Link and Collective Energy that will be speaking with us later on today. We also have been involved in the White House strategy group on hunger and nutrition, and around telehealth, we're directly involved in cross-functional initiatives to really support and advance telehealth within community health centers. We feel like these activities are really foundational for us to move forward in environmental health initiatives within NAC and community health centers. Next slide, please. So with that, what I'd like to do is invite Nova Thayer to provide us with an update on some of the federal environmental health and climate change policies and initiatives. Nova?
Thank you so much for that introduction, Ben. Hi, everyone. I'm Nova. I work on the federal affairs side of things. So whatever's going on in Congress, it's my job to know. So next slide, please. Today, I'm just going to be giving you kind of a brief update of the last year and a half of what Congress has been up to on environmental health, climate change, and I'm happy to report that it's been actually pretty productive for congressional standards. The Inflation Reduction Act is the big thing that passed this year. Billions of dollars towards various climate initiatives, that sort of thing, both climate change and environmental health. So there's a lot of money into that can go to some really good stuff. And most importantly, we think health centers might be able to take advantage of some of the new tax credits and grants and opportunities that have popped up. There's also the House Ways and Means Committee released a report that a lot of health centers responded to on healthcare and climate change. So the report's really focused on health center needs. So thank you all of you responded to that. We really appreciate it. And then on the kind of federal bureaucracy side, the Biden administration has made environmental health and environmental justice a pretty big priority. So Their main thing is they have a Justice 40 initiative, which basically mandates that 40% of federal spending or certain types of federal spending has to go to disadvantaged communities, which is a pretty ambitious goal because the government wasn't doing anything like this before. So to accomplish that, they've been creating new offices in various departments, like HHS got a new office, the EPA got a new office. Some of the other agencies got new offices too, but for health centers, those two are definitely the most relevant. So yeah, next slide, please. So here's just a couple more details on the House Ways and Means Committee. Basically, I think around March 2022, an RFI came out asking, how does climate change affect healthcare organizations? How does it affect your patient populations? It says right there, NAC and 26 health centers provided their input. So we were about 54% of the provider types that were surveyed. So at the end of the day, the committee recognized that health centers were the most vulnerable and the least equipped for dealing with climate change and just extreme weather. So for example, only 1 in 6 health centers respondents reported having internal sustainability targets compared to 8 out of 9 hospital systems. So a severe lack of access to resources, federal tax credits, incentives makes it difficult to set that stuff up because health centers have a lot going on. It's hard to set up new programs without financial support. Next slide, please. And then also, this is just a bit more detail on the federal side. Basically, the HHS Office of Climate Change and Health Equity, it's a new office created late 2021. Its official duties and priorities mostly focus on identifying communities with disproportionate exposures to climate hazards, vulnerable populations, an issue that's probably going to be very important in the next couple decades. It's trying to address those health disparities caused by climate impacts, and then just provide coordination, expertise, and partnership opportunities with both other federal agencies and private sector actors to try and transform the health center. And so this one's through HHS. And then next slide, please. The other one, this one's through the EPA, the Office of Environmental Justice and External Civil Rights. Very similar mission set, basically. It looks to oversee the implementation. It's basically everything I said in the previous slide, but crucially, this office has been tasked with overseeing the implementation delivery of the $3 billion climate and environmental justice block grants that were created by the IRA. We'll talk about that more in a little bit. But so that's going to be its main focus, but then it's also improving the EPA's ability to infuse environmental justice, civil rights principles, increasing support for community-led action, that sort of thing. So it just kind of shows you the Biden administration's focus on trying to get kind of the Justice 40, environmental justice, trying to avoid the previous government approaches of spending a ton of money and then it doesn't end up going to, disadvantaged communities. So it's an attempt to do that. Next slide, please. And then where's all this money coming from and how is this actually going to happen? This is kind of the big deal, the Inflation Reduction Act. There's a lot in it. We're going to focus on the most relevant things for this presentation. Notably, the clean energy tax credits are the ones you'll probably want to get the most excited about as much as you can for tax credits. It basically says that tax-exempt organizations, including health centers, government entities, Indian tribes, are eligible for refundable tax credits to promote things like solar, wind, clean hydrogen. So for example, in solar, there's a 30% floor with potentially up to 60% off via tax credit if you meet certain conditions, which are mostly being in a, like if you're going to get hit hard by climate change, I believe that's 10%, provisions like that. There's also environmental and climate justice grants, which I just mentioned, which is about $3 billion to invest in community-led projects in disadvantaged areas. Basically, if you're disproportionately hit by environmental and public health harms, which many health centers are, and it's related to pollution and climate change, these grants are designed to help with that. Specifically, they're eligible if they partner with local governments, Indian tribes, institutions of higher learning. And then finally, there's a greenhouse gas reduction fund, which is $27 billion in funding, which can be utilized by nonprofits if said nonprofits provide capital or financial assistance to the projects and the people trying to do them, which is directly relevant to someone who's coming up right after this. Includes $7 billion in grants for zero emission technologies, $12 billion in financial and technical assistance, and $8 billion in more financial and technical assistance, but specifically for disadvantaged communities. And then finally, there's just some of the broader stuff. The IRA also extended the ACA tax credits through 2025. And it allowed Medicare to negotiate prices for certain drugs. So it was a big bill, but we're just focusing on these for now. So I'm sure you're wondering, how do you take advantage of these tax provisions, grants? Because it's a lot, and you also have to run a health center at the exact same time. So I'm pleased to report that NACC has a new partnership that is designed to help with that. Linked right there at the bottom, Capital Link, Collective Energy are all very valuable partners that can help your center access these tax credits, funding opportunities, help you take advantage of them, start the projects that could help decarbonize or make your operations more sustainable. So next slide, I think that's the perfect pivot to that.
Yeah, thank you so much, Nova. And so now I will ask Becky Regan and Andrew McCullough to join us on the call. Becky is the CEO of Capital Link, and Andrew McCullough is one of the co-founders of a great organization called Collective Energy. So Becky and Andrew, would you like to talk more about the Charge partnership?
Sure, that'd be great. Thanks, Jess. And thanks, everyone. I'll just do an overview and then let Andrew jump in. As Jess, Nova, and Ben did a fantastic job outlining some of the options that the Biden administration has put forward. This model that we've put together with we collectively, Collective Energy, Capital Link, and NACC is really to deliver a turnkey solution for FQHCs across the country by partnering with foundations, investors, and nonprofits that support FQHCs and a clean energy solution. So together we are providing resources to health centers interested in learning about solar and solar plus battery backups options, and we'll evaluate sites and health center needs. We'll design, install, commission, and maintain the solar installation so health centers can focus on delivering care to its populations. The Charge partnership, which is the Community Health Access to Resilient Green Energy, is a name that we've put together for this effort. And I'm going to turn it over to Andrew to talk more specifically about the problem and our solution. Andrew, you want to take it from here?
Sure, thanks, Becky, and thanks, Jess and Ben, for having us, and all of you for your interest in this. We're excited to be talking to you about this issue today. Real quickly, background was 15 years emergency response vice president at Direct Relief, so I've been on the ground after sort of every major disaster around the world, but in our country, supporting health centers when they'd lost power, and just became this thing that kept repeating and repeating and repeating. And I, having some experience with it in Puerto Rico, decided to start the social benefit company to specifically support FQHCs to understand their options for resilient and clean power, which can keep them open, save them money, and be better for our planet. And so we can help educate health centers about a system-sized design, help them install systems, and in partnership with Capital Link and Becky and Capital Fund, even help finance the systems on behalf of the health centers. But also, as we just heard, there are so many different funding streams out there for health centers and nonprofits specifically to tap, that we think, at least we can help arm you with the information you need. What size system do you need? How much will it save you every month on your power? And really, what does it mean for you to stay open? I think one of our goals is to make sure health centers know that going out and buying a generator is not necessarily the right or best option anymore, even financially. So I think we want to be a resource, and together with NACC and Capital Link, we think we have this kind of amazing partnership to arm health centers with the information and tools that they need, as well as funding resources they need to actually go out and get a clean system in place. And we're already working with about 50 health centers, have installed dozens of projects already. Health centers are saving hundreds of thousands of dollars on their electricity costs and don't have to scramble to keep power on when there's a ever increasing outage in our country that unfortunately we don't have a good option to solve for, other than this one. So thanks again.
Thank you so much, Andrew and Becky. And with that, Ben Money, would you like to introduce our next guest?
Yes, thank you, Jess. And thank you, Becky and Andrew. I'd like to introduce to you Ben Fulgencio Turner. Ben is the Director for Climate for Health, a part of Eco America. Eco America is one of the largest organizations focused on educating the public to really take action on this increasingly growing threat of climate change. And we at NACHC have partnered with Eco America, as well as hundreds of other national healthcare organizations, to really recognize the health-related threat of climate change. And so Ben is going to discuss his organization, but also the opportunity that we've created in our partnership for health center specific resources to educate providers and administrators, staff, and patients of health centers about what concrete steps and actions can be taken to address this issue. So Ben, thank you so much for being a part of our webinar today, and I'll turn it over to you.
Thank you, Ben. I'm really happy to be here. So and thank you for that introduction. So I'll just go ahead and jump into the next slide. So I work at, as Ben said, I'm the Director of Climate for Health at Eco America. And so we work nationally to really build momentum and support for health leaders and organizations to act and advocate for climate solutions. And so we do this through institutional work, developing tools and resources, providing that direct education and resources to healthcare providers and public health workers on the ground, and then providing ongoing support around advocacy, action, and engagement. Next slide. So I'll just have a few charts here, not too many before I get into the rest of it. But this first one really just shows just two quick bar graphs. The first one showing the percentage of people who are concerned about climate change. So almost half say they're very concerned, and 75% total say they're at least somewhat concerned. But then when you ask people how concerned they are around how concerned other people are, only 14% of people say that other people around them are very concerned. And so there's a name for this called pluralistic ignorance. When you believe that your personal attitudes are just different from the majorities, that nobody else cares about climate change, even though it's something that you're worried about. And this has a really pernicious effect of isolating you, kind of putting you in a spot where you don't want to bring it up because you think you're alone, which builds this little cycle where all these people who are worried about it don't talk about it, think they're alone, don't take action. And so the positive thing, why I wanted to put this at the very top, was that you probably are not alone, that there are other people around you. No matter how sure you are that you are alone in being concerned about climate change, most people are concerned about it, and starting to talk about it can break through this bubble, talking about your concerns, what you're doing about it, and what you could do about it, and helps to really build momentum and break out of that cycle. Next slide. And related to this, the biggest motivator for climate action is personal and community health. It dwarfs everything else, including the really big ones of jobs, economy, resilience, and justice. People's personal and their community health is the most important motivator for them. And next slide, the last one here, Ben Money already talked about this earlier, that nurses and doctors are the two most trusted professions in the country, that the healthcare providers are in a position of incredibly high trust, and that it really puts this incredible opportunity and platform to engage people about how their health is affected by climate change from a trusted source to really help move forward towards solutions. Next slide. And so that's really what we work to do. So we work to give those tools to organizations, individual providers, public health workers across the country. So all of our national partners, that includes NACHC, it includes a lot of other folks, and we're really excited about it. All right, next slide. I'm going to dive into a little bit here on the background of for climate change. So this just shows out the different drivers of climate change. So climate change or global warming is really caused by one big thing, and is burning fossil fuels for heat and energy. It creates burning gas, coal, methane, which has gotten successfully rebranded as natural gas, but it is methane. When we burn those things for energy, it produces greenhouse gas emissions, primarily CO2, carbon dioxide, which then traps in heat and doesn't let it escape our atmosphere, causing that global climate change. I won't go through all these numbers. It's clear here that the big two in the US are burning fuel for transportation and burning fuel to produce electricity. Next slide. And then this one is, I think this is the last chart I'll make you all look at. This is a very long x-axis going back hundreds of thousands of years. And the blue line shows the concentration of CO2 in the atmosphere. So you can see it's pretty cyclical, that it's been going up and down and up and down. And now we are just in the last 50, 100 years have gone way, way higher than it's ever been, that we've ever been able to measure it being anywhere near this high. And the red line below that tightly correlates with it is the average temperature on the planet. So you can see that it's very concerning to see that blue line going so high, and that red line is likely to follow into scary territory. Next slide. And this kind of leads into the increasing frequency of climate disasters. So this map shows all of the billion-dollar climate disasters in 2021. Up until 2020, the record, I think, was 16 billion-dollar climate disasters a year, and now there were 22 in 2020, 2020 and 2021. So there's more and more of these. There's been 7 straight years with 10 or more billion-dollar disasters, and these range from the wildfires, inland flooding, hurricanes and storms on the Gulf Coast, and Caribbean, as well as things like when the polar vortex doesn't stay locked in up in the Arctics, the warm water causes it to dip in these unstable patterns, which includes things like that, the Texas hailstorms and icing that shut down the grid in big chunks of Texas. That these can be things, but you think global warming, you don't necessarily think unpredictable ice storms in warm areas, but that is part of the disruption to the climate. So all of these really do add up to both the property damage listed here, but then also loss of life, significant health impacts, and ongoing displacement and trauma to lots of communities across the country. Next slide. So I'm not going to read all of this print. The big things that we want to hammer home here is that the climate system is warming, is changing, becoming more unstable and more dangerous. It is caused by burning fossil fuels, and that these climate change impacts, as we'll get into, harm some more than others. Yeah, I think that I've already heard the phrase "first and worst," that the communities that are already suffering lots of other historical injustices are in the path of a lot of these worst damages and have the least vulnerability, the least resilience to withstand them. But that we can take action by limiting CO2, by building in adaptation and mitigation responses. We can really reduce the impact. Next slide. And the 3 big things that are centered to solving this, to reducing the suffering and damage caused by climate change, is by being ambitious, by stopping burning these dangerous chemicals and minerals, and start getting carbon out, restoring nature, so that we can have a clean and healthy environment, and throughout all of that centering justice. That there's no way to do this work without having an equity lens, without having a focus on the communities that are in the path of these disasters. I like to think if you're planning a hurricane evacuation plan and you don't talk to people with disabilities or people with limited transportation options at all, you don't bring them to the table at all, it's just not going to be a good plan. And it's the same with responding to climate change. We need to be aware, engage, center the needs of the communities that are facing the most risk, and make sure that it's built into all of our efforts to address the challenge. All right, so this is just a fun infographic from the Lancet report showing at the top the big climate pressures of increasing temperatures, more severe weather, rising water, rising sea levels, and then just wildly extremes of precipitation, so that's droughts and flooding. And then that trickles down to the different exposure pathways for the health harms, which then are listed below. So I'm going to talk through some of these health harms here in the slides below. I'm going to be going through these pretty quickly, but there's a lot more content available online, and I'll share links later. Next slide. I've already mentioned the first and worst and disproportionate harm. Racial and ethnic people of color, communities of lower income, rural communities, tribal communities, territorial and Pacific Islanders, all face significant historical and ongoing injustices that increase their vulnerability. And they also are more likely to be in the path of these disasters. So they fall right in the middle of this little Venn diagram where they are more likely to be exposed to these hazards and more likely to be vulnerable. So I'm sure that sorry, next slide, that this is a graphic that everyone here has seen, that these social determinants of health really are going to be are central to understanding climate change as well as health in general. Before I started at Eco America, I spent about 14 years working with safety net healthcare providers and local government around programs to try to go as upstream as possible, try to build out connections between social services, the local clinics and local programs to address social determinants of health. And so I understand that it's already there's a lot there. Just trying to address even the quote unquote easiest of food insecurity on these is really tough. And what I'm hoping is that this presentation and that understanding of climate change isn't something that's just adding to the list, because I mean the reality is that this is happening anyway. That climate change is going to affect people's health, going to affect all of the different social drivers that do affect their health, and that having an understanding of it, an awareness of the tools, is really meant to be something that that makes it so this isn't just something that's happening to us, but something that we can take action on, that we can understand and engage with each other and with our policymakers in a way that's really meaningful. And with that, I'm going to jump into some of those health impacts. So the first and most intuitive of something that for a long time we call global warming is it's going to be hotter. And heat is something that people understand is caused, the hotter days, longer stretches of heat waves, and greater humidity. People understand that this is caused by climate change, but really people do not understand how dangerous heat is, that it is one of the top killers of people, of all weather events. It kills lots and lots of people and causes millions of hospitalizations, as well as a lot of adverse birth outcomes. And as the heat waves increase in intensity and length, this will get more serious. Next slide. And for lots of communities, there are greater risk. So I just have here highlighted outdoor workers. Also, I mean, there's urban heat traps in many cities where cities that have disproportionate areas of green space and lack of green space, often tied with historical residential segregation, means that communities of color are more likely to live in neighborhoods that are significantly hotter, even within the same city. And outdoor workers, who are also more likely to be people of color, also face significantly more exposure to heat, and have both the health effects of that as well as the risks of doing manual labor, sometimes with machinery, while being extremely hot and worn out. So it brings significant immediate health risks to lots of communities. Next slide. The next big one is air pollution, and just in general air quality. And before I dive into the specifics of it, one of the pernicious cycles again of climate change is that burning fossil fuels creates pollution, lots of different types of particulate matters that are very, very bad for you. And the effects of climate change both increase ozone and other things that are bad to breathe in. It worsens air quality, and the heat can help to trap in that poor air quality so that we are more likely to breathe it. So there's a negative feedback loop that makes it so that as if we continue to burn fossil fuels, we will both suffer from greater climate change and suffer from worse air quality in this reinforcing cycle. And this adds up just by just burning coal plants adds up to almost $200 billion in public health costs. Okay, next slide. The other big one on air quality besides burning on purpose is burning not on purpose. So wildfires cause incredible amounts of hazardous pollution that people breathe in. And this doesn't just stay in the area of the fire. There are times where the air quality in Chicago and in cities in Minnesota are severely compromised due to wildfires on the West Coast. And of course, being in the path of a wildfire causes other health concerns, chief there being anxiety and depression, directly caused by being at that risk. Next slide. So there are disproportionate impacts across race and ethnic lines. So first, people of color are more likely to be exposed to air pollution due to, again, historical and ongoing segregation and discrimination. And so much higher rates of being exposed to poor air quality. One more click. And then also this then leads pretty naturally to much worse health outcomes along these racial and ethnic lines. Next slide. Hurricanes are also an area where people understand that this is closely related to climate change, but people don't always understand the full extent of the health impacts. So of course, there are those acute impacts of being in the path when a hurricane hits, but there's significant long-term impacts. So I remember I was in New Orleans for a few years after Katrina, and there were still entire neighborhoods where there was still just black mold in many houses, compromising air quality for people who lived there. And of course, and there was a disruption in the supply of healthcare, especially safety net healthcare. And so it really affected health in that community over the long term. And the picture in this slide is from Hurricane Harvey. And that water was not clean water. It was not water you want to be exposed to. It included arsenic, lead, E. coli. There are many refineries and chemical plants that were affected by the flooding. And so this is a lot of really dangerous chemical exposures just from being touched by that water, or even your home being touched and then dried out later. So hurricanes and heavy rain have really significant effects. Next slide. And of course, they also don't affect, they affect communities of color and lower income people at a higher rate. So there are people of color and lower income folks are more likely to live in areas exposed to the risk, less likely to be able to evacuate, and more likely to have some of those vulnerabilities we talked about. Next slide. All right, so moving on from flooding and lots of rain to the lack of rain, of droughts. So of course, these make the wildfires I mentioned earlier a lot more likely, but also they have direct health impacts themselves. So dry soil increases the number of particulates that are suspended in the air, and so that can irritate the bronchial passages and lungs. And so it can make asthma and other chronic respiratory diseases worse and increase the risk of infection of bronchitis and bacterial pneumonia, and including infections like valley fever. They also, as it dries out, it can concentrate any existing toxic chemicals in water supplies. So that can contaminate water if you drink the water, but also it can contaminate the fish or other seafood living in that water. And in some areas, it can become so thick that it can affect the breathing air. They can evaporate off of the water. And so you don't even need to drink the water or even touch the water to be exposed. So drought does have these kind of not intuitive health impacts as well. Next slide. And then here's everyone's favorite slide. It's just a nice zoom in on a mosquito. So if you live, I live just outside of DC, and I will say that the mosquitoes are getting worse. It's not just in my head. So mosquitoes, both their range is expanded and the hotter temperatures make it so their metabolism runs faster, which means they bite more. And all of that is not only annoying and really unpleasant in the summer months, It also spreads lots of really nasty diseases. Next slide. And then here we have, starting off, the image now shows the concentration of deer ticks in 2000. And with one click, we will see what it looks like in 2015. So you can see same kind of deal, warmer temperatures, more humidity, extends the range of vector-borne diseases, and is reaching a lot more people with pretty serious infections, really dramatically. Next slide. So next up is on food. So not only do droughts and flooding and other severe weather disrupt the natural growing season and can cause sudden spikes in food prices, which will affect food security for lots of folks. Also, the increase in CO2 levels actually reduces protein and essential minerals in many crops. So we know that that we're going to be seeing more food insecurity and sudden spikes in prices, as well as generally some challenges of nutrition in some of the crops. So really concerning to discuss that. Okay, next slide. All right. So moving on to mental health, and I promise that I'm almost done with all of the health impacts. So this is, we have a full report on this, and I could use up our whole time today talking through all of this. But there are really significant mental health impacts of climate change that are both acute and chronic, and both at the individual and at the community level. So next slide, I'll just talk through a little bit of the individual impacts. So first up are the acute impacts. So this would be something like if you survived a wildfire or a hurricane. It could cause significant trauma, and it could have all of the, it could actually cause you physical harm that is very stressful. We also know that heat waves increase aggression and the rates of violence. So there are all these kind of immediate acute impacts of extreme weather. And one more click to get the chronic impacts. So of course, there's dealing with the acute impacts, the PTSD from the trauma, as well as things like displacement, losing your job and your personal identity because of it, as well as eco-anxiety, which is now a DSM-5 recognized condition that manifests as, to pull it up, high levels of stress over climate change with symptoms including panic attacks, obsessive thinking, loss of appetite, and insomnia. And we know this is especially common among younger folks that kind of are looking forward, looking ahead to more climate problems and being aware of some of these challenges. Next slide. So kind of cutting across this entire the area of different health impacts. So a 2021 report estimated that the total costs of this add up to $820 billion per year. So that's medical treatments as well as loss of work. All of these compounding costs really add up to nearly $1 trillion a year of costs. Okay. Next slide. All right, so I just went through all of the really bad news. And I will say that when we run our full training on how to be a Climate for Health ambassador, we tell you to not do exactly what I just did, which is to spend a huge amount of time talking about how bad the impacts of climate change are, because it can be really demotivating for folks. I know that people on this call are clinicians and healthcare workers, and I wanted to just focus on sharing that information. But we do actually have a training that focuses on how to communicate focused on motivation and action. And so the next slide shows just a quick grab of this. So Ben Money mentioned earlier that we are really proud to partner with NACC to develop a customized version of our Climate for Health Ambassadors training. This is a 3.5 to 4 hour long training that aims, so you've seen some of the slides already, but there's a lot more content that covers both the health impacts of climate change, solutions both as an individual, as a healthcare worker, and at the community and the policy level, with a lot of focus on communication tool guidance and advocacy tools. And it does have 3 units of CME and CNE that are attached at no cost. So as soon as our customized training aimed at health centers is available, you all will be getting a link. And then I believe at that same time frame, we'll have more options for CME available to share too. So stay in the loop. And if you can't wait until then, you can take the training now at climateforhealth.org/ambassadors. Next slide. So I mentioned this is our communications guidance. I just wanted to put this here just to promise you that we don't want to convert any of you into doing as depressing a walkthrough as what I just did. We really try to make this stay focused on people, on empowerment, on positive impacts, because we really can make a difference and prevent a lot of the worst harms. Next slide. And speaking of that, if you are not able to take the training, or if you're looking for more resources that aren't a few hours of videos and interactive quizzes, we also just have a printable worksheet here, the Moving Forward Guide. So climateforhealth.org/moving forward toolkit with dashes in between. And please check that out. It has a lot of the guidance on how to engage in climate action. All right, next slide. Thank you. Nova already talked a lot about so many of the really positive benefits from the administration so far. I just wanted to highlight the Inflation Reduction Act. So first off, just that it really is it doesn't solve climate change, but it is a game changer, that it brings down our projected emissions to 40% below the 2005 levels. So not full, it doesn't get the job done. We need a lot more, but it really puts us on the right path and creates pathways for state level and more federal action to push the rest of the way. It has about $370 billion to develop green infrastructure, hundreds of thousands of new jobs directly supported, and possibly millions more, or likely millions more from the new capacity and development that will grow out that isn't directly funded but is subsidized. Next slide. And then looking at what this means for individuals. So Nova has so much of the great material, and NAC is doing a great job of pulling together how to access the benefits organizationally. But that individuals also, there's a lot of benefit there. You can get tax credits for replacing your gas stove with an electric stove, especially since we now know that gas stoves increase the rate of asthma among children. Your water heater and furnace with heat pumps, putting solar panels on your house. So there's all kinds of tax credits available to individuals as well as to organizations to make a lot of these switches to things that are both cleaner and help to solve the climate crisis while also reducing your exposure to these really nasty chemicals. And then again, Nova talked a lot about this, the equity and justice component. Really excited to see the Justice Block grants where 40% are going to be going out to vulnerable communities. And I'm sure we'll be, as we learn more about the implementation and what the pathways are to apply and be in the loop for those funding, we'll be staying in contact with everyone. Great, thank you. All right, and I think that now we're going to hear more about action on the ground from Crescent Care. Is that right, Jessica?
Yeah, that's right. Thank you so much, Ben, for that overview. And we really appreciate you touching on all the distinct and diverse ways that climate change is impacting our health already, and how that is only going to increase for the worse in the future. And we really appreciate all of the great resources that Eco America is providing to anybody who wants to use them, especially healthcare providers. So thank you for this great work and for your partnership. And now Reginald Vicks is joining us to give a quick overview of some of the great work that they are doing in New Orleans at Crescent Care. So Reginald, are you on the call?
Yes, I am.
Hi.
Hi, everybody. I know we're running a little short of time, and wanted to save some time for Q&A. So I'll give you a high level. So obviously New Orleans is in what's known as Hurricane Alley. And so we're impacted significantly when a hurricane passes through, mainly the risk of flooding and also power outages. And, you know, as a community health center, in this part of the country, those environmental factors create a lot of issues for clients getting access to services, and also significant interruption of quality of life, and also exacerbating social determinants of health around food insecurity, medical treatment, et cetera. And so our project is the first one for a community health center in the New Orleans area. And working in partnership with Direct Relief, we are installing solar panels, and we're redesigning our emergency backup system so that we can actually power our entire building. Those of you in healthcare, you know that, especially in hospitals and clinics, particularly, backup generators don't always cover 100% of the need in order to keep all services active. And so we were significantly impacted by Hurricane Ida. And what ended up happening is that we lost close to $1 million in products, including medications, testing instruments, and so on and so forth, due to power outages and the lack of air conditioning services, for example. And we also were impacted by supply chain. The exacerbation of supply chain issues with the pandemic, and then a hurricane on top of that. Our backup generator system, a diesel powered system, which is pretty consistent with what a lot of people do, we could not get fuel. And so our generator failed, which caused the, you know, sort of that downward spiral of not being able to provide services. So with this project, we'll be able to power our entire building if the power goes out in the area, and our solar backup generator emergency management power source will work in conjunction with a new and redesigned primary generator system to outfit our entire building and keep us powered up. So as a community lighthouse, we call this the Community Lighthouse Initiative. As a community lighthouse, then people in the neighborhood and the surrounding area can come and charge their cell phones, find a cooling station, and receive access to all the services that we provide. The building that you're looking at in the slide is about 65,000 square feet. You can't really tell, but it pretty much encompasses almost the entire block. And we have food pantry, prevention and outreach services, testing services for HIV and hepatitis C, syringe access program, primary care, behavioral health services, case management, dental services are all located in this building. And we could not operate during Ida to provide those services. With this new project, we will be able to do that. We're also working in conjunction with an organization called Together New Orleans, which is a grassroots community advocacy organization, to create lighthouses, initially 33 lighthouses in our region. And we're trying to work with our PCA and other community health centers in the New Orleans region to spread the Community Lighthouse Initiative across FQHCs. So that's really it in a nutshell. This particular clinic is positioned in one of the most highly vulnerable areas in New Orleans. The zip code that we're located in, we chose that zip code because of the need. And so it's critical that we do not have an interruption of services, because the people in this neighborhood, in this section of the city, have transportation issues. They have access issues to other medical resources. Typically, they would go to an emergency room to get their resources, their needs met. And so we really play a vital part, as so many other FQHCs in the country do, to support the local community. I'll leave it at that. Oh, one last thing. Andrew McCullough and Director Lee have been instrumental in supporting this initiative. And so I just want to give a shout out to them because we couldn't have really launched this without them as quickly as we have. So.
Thank you so much, Reginald. We love hearing about this initiative and just the great work that you're doing. We think this is just an incredible initiative to, both mitigate climate change and also respond and adapt to the impacts of climate change. So thank you so much. And with that, sorry, Ben, this is for you.
I'll throw it out there real quick. So I think that this is just a perfect segue for 15 seconds on this, that these kinds of programs where people are taking action, are integrating climate into health response, understanding its intersectionality with health equity, exactly what we want to award any kind of climate engagement like this. Today is the deadline to nominate for our American Climate Leadership Awards. So these are not grants. There's no budget. There's no work plan. We just want to hear about climate action. So please do apply if you have not already, and nominate anyone you think would be a good contender, either individuals or organizations. That's it. Yep. And email me if you have questions or ask them now. Yeah.
And thanks. I just want to call your attention to a request from the Bureau of Primary Healthcare. You may have seen it earlier this week for their Health Equity Technical Assistance Symposium in March. They're looking for program abstracts from health centers that are doing this work. And track D of this request is climate change and environmental health. So, for you health centers that are engaged in these efforts, please submit your abstracts to be a part of this symposium. Thanks.
Thank you. And so we're going to leave this up for a few minutes, but if you want to get on our email list and join our interest group, we would love to have you join. You can feel free to email me. That's my email. Also, there's a QR code that will take you to a Google form so you can input your email information. And I think Sarah is going to be following up with a link to that in the chat as well. But I know we're running short on time, so we just wanted to give you the opportunity to ask some questions about any of the information that we presented today. So if anyone wants to come off mute and ask your question to all of the people we have on the call, we would love for you to do that now. If not, we can go through a few of the questions in the chat. But I'll just pause really quickly and see if anyone wants to come off mute and ask a question.
Hi, this is Elisa Nicholas from TCC Family Health in Long Beach. Are some of these grants available for existing buildings or buildings that are currently being built, or is it only newly planned buildings, et cetera?
It's actually for existing buildings as well as for new construction. And I can turn to Andrew for any more details on that.
Okay. And so you think talking to Capital Link in the group there is the best?
Yeah. Yep.
And okay. And you're going to send out those slides and links to us?
Yes.
Thank you very much.
Thank you so much. Great question. Anyone else? Sarah, can you pull up any questions that you saw come through the chat?
Yeah, absolutely.
One on electric vehicles, and that's another area that we're working to get more information on, particularly as the Inflation Reduction Act has some tax credits for those as well.
Thank you.
It'll be I've seen switching school buses and some city and local fleets getting switched to electric. It's really exciting. Yeah.
And mobile health clinics as well.
Yeah. Yeah.
Oh.
Mobile health clinics, transportation vans. And we've been in contact with some vendors that actually have hybrid and are moving towards electric mobile clinics.
And just one quick thing to add is when we're helping health centers get solar on their buildings, we're also helping them think through EV charging stations, getting them rebates for those. It's a good time to add EV charging when you add solar. And then to the last question, for folks in California, new health centers, new buildings all throughout California are going to be required to have solar and battery backup, all new commercial construction. So definitely good to be thinking about it for new builds already, but also we're largely working with health centers on their existing buildings.
Mhm.
Awesome. Thanks, everyone. I think we have one more question, which is, are you familiar with any individual level screening tools for climate change vulnerability or environmental health? For example, screening tools for individuals accessing healthcare services.
Yeah, so in fact, I put a link in the chat to AmeriCare's and their Resilient Clinic Toolkit. There's actually going to be a formal announcement through the Boston Globe next week on the 6th. I can send the link out after this webinar to that. But within that toolkit, there's some screening programs, screening tools as well. And we will be utilizing that toolkit as kind of the foundation of the learning collaborative that we'll be announcing in January with, and again, that's going to be with the Harvard School of Public Health, the climate change program, with Migrant Clinicians Network, and with AmeriCare's, and with the Arch Rock energy program.
Thanks, Ben. Any last questions before we close out for the day? And just, yeah, I've heard, people talking or seen some questions come through. We will definitely share the video of this presentation with all of you. And we'll also share a list of resources that we mentioned during this call so that you can have access to them. But again, we thank you so much for spending your time with us, for your engagement, and for your interest in this topical area. So just taking one last question if there is any. And if not, we can definitely close out for the day.
Jess, there's one last question in the chat is, when do you expect the training on climate change to be held?
Was that for the ambassadors training? So so the ambassadors training, yeah. So that will be it will be an on-demand training, online training that should be ready by February or March.
Okay.
So we'll be sending that out once it's up and posted.
Will it be very different from the current one you have online?
So there'll be additional content in it that focus
watch it
specifically
again
on the community health centers.
We
Yeah.
can watch it. We could watch it again and get that new information.
Yeah, if you wanted to start now, you could.
Okay.
And then yeah, you could always reach out and we'd be happy to kind of get you over that additional content if you're really interested in diving into it. Yeah.
Okay, thank you.
Thanks.
Thank you. Okay, so I know we are over time. So again, thank you for joining us today. And please, if you have any questions or comments, please feel free to reach out and email me. We also are collecting stories about how community health centers are, adapting and mitigating climate change and environmental health issues. So we also would love to hear your stories and be in contact with you. But again, thank you so much for your time today, and we wish you the best day and the best end to your week. Thank you.
Thank you.
Thank you.
Thank you.
Bye.